Hi, everyone, and welcome. Thank you so much for joining us for Web Accessibility 101 for Healthcare Marketers, hosted by Staymates, a digital marketing agency that helps healthcare organizations create inclusive, user-friendly web experiences. Today's topic is more than a checkbox. It's one, a legal requirement, and two, a patient experience imperative. The new HHS Section 504 rule means federally funded healthcare organizations must meet WCAG 2.1 AA standards by May 2026. We're lucky to have Amanda Gansemer with us. She's an experienced web accessibility expert who helps organizations across the country take real actionable steps toward compliance. She'll walk us through what the rule requires, where marketers often go wrong, and what you can do to start today. We'll have a quick Q&A at the end, so please drop your questions in the question box as we go. You'll also receive a recording of the session along with some slides in the upcoming days. And with that, Amanda, I'll turn it over to you.
Great. Thanks, Chris. Welcome to Accessibility 101 for Healthcare Marketers. As Chris said, I'm Amanda Gansemer. I am a senior web designer and developer, and I'm also a certified professional in web accessibility. My pronouns are she, her, and I'm a white female with long brown hair and blonde streaks framing my face. I'm wearing dark rimmed glasses and a white cardigan sweater. And some of you are probably wondering why I just described the way I look when you can clearly see that in the video. But it's important to understand that not everyone has the same perspective. It's possible that you're listening to this webinar while you're driving, or you're multitasking and you have another window covering the presentation, or maybe you have low or no vision. In all these different scenarios, that little verbal description of myself is helpful to provide an equivalent experience. And that is what accessibility is all about. So before we get too far, I need to state that I am not a lawyer and I have no legal background. So everything you learn here today is strictly for educational purposes. And if you are seeking legal advice regarding accessibility or Section 504, please consult a civil rights attorney or other legal professional. So with that out of the way, I'm going to stop sharing my camera just so I don't have a lag during this presentation. And let's talk accessibility. All right. So it wouldn't be Accessibility 101 without talking about why accessibility matters. First, it is the right thing to do. Accessible apps and web content means that everyone is included. We can all participate, which promotes independence. Second, it's the law. Third, patients with disabilities are more likely to need healthcare. And for healthcare providers, providing care for their community is likely their primary goal. Next, and this one's really important because a lot of people don't understand, but coding websites for accessibility improves your SEO because, like assistive technologies, search engines read code. So if you have clean code, you have better SEO and better accessibility. Improving accessibility improves the overall user experience, and if done well, it could be your competitive edge. Now, in the United States, there are two main accessibility laws. There's the Rehabilitation Act and the Americans with Disabilities Act, or ADA. Both Section 504 of the Rehabilitation Act and Title II of the ADA apply to various organizations. But today, I'm going to focus on Section 504, which applies to hospitals and healthcare providers that receive federal assistance. Let's talk a little bit about the history. So prior to 2024, there was a lot of confusion around digital accessibility because when these laws were written, they primarily focused on physical spaces. Eventually, it was decided that websites fall under these laws as well, but there weren't clear guidelines on what was required. So companies were confused about their responsibilities, Consumers were frustrated with the lack of accessibility, and lawsuits for websites were on the rise. Now, in 2024, the laws were updated to mandate WCAG 2.1 AA standards for web content, mobile apps, and kiosks. And this is a really big win for accessibility advocates because there are now clear requirements and deadlines. And if you happen to fall under both Section 504 and Title II, these laws are now mirrored. So you have many of the same obligations under both laws. If your organization has 15 or more employees, your digital properties need to be compliant by May 11th, 2026. If you have 14 or less employees, you have until May 10th, 2027. For many of you, this deadline is probably fast approaching. Don't worry, you do have time. However, you do need to get started. The Department of Health and Human Services expects you to budget, plan, develop, and test your improvements. Compliance is not intended to be a last-minute fix, and I want to stress that there is not a magic tool that is just going to make your website compliant. However, to ease some of the burden, Section 504 does allow exceptions. So for some specific web content or app content, you do not need to go back and retrofit or make this content compliant. And we'll go into this a little more later because first I want you to understand what accessibility is. Now, I'm not going to spend too much time on WCAG and what it is because you can easily find all that information online, but I am going to give you a very high-level overview. WCAG has 3 levels of conformance. There's single A, double A, and triple A. And each level builds upon the previous level for higher standards. Meaning, to be double A compliant, you must also meet all of the single A requirements. Now, there's 50 different success criteria or requirements that each page of your website needs to meet to be double A compliant. Now, that's way too much content for a 30-minute webinar. So I thought I'd focus on 6 common accessibility mistakes that I see when testing. Sometimes we may have the best intentions, but we actually end up making the user experience worse. On this slide, I have an image of a double ramp that leads to a closed door. On the ground between the 2 ramps is a sign that reads, "Keep clear for wheelchair users." And it's a pretty large sign. It's blocking the path. So ironic, right? This just goes to show you that technology, or that you can technically be compliant, but still have accessibility or usability issues. So the first issue I often see is missing or unhelpful alternative text, also referred to as alt text. All images must have an alt attribute in the code, but they do not all need alt text. If an image is decorative or the information is provided in text somewhere else on the page, then alt text is not required. To mark an image as decorative, you simply leave the alt attribute empty. Or depending on the editor, you may have a checkbox to mark the image as decorative. Now, does that mean you can just mark all your images as decorative? Of course not. It just means that you need to understand when to use it and how much description to add. So let's look at a healthcare specific example. On this slide, I have a typical doctor listing with a profile image, the physician's name, star ratings, address, and a link to view their profile. When I inspect the alt text for this image, it reads, "Image of Dr. Cecile." Now, similar to the ramp example, although this is technically compliant, it's not really helpful. So when writing alt text, there are some things to keep in mind. First, don't use words like image or photo, in the alt text. Screen reading tools already announce the object as a graphic from the image tag in the code, so you don't need to repeat that information again. If the alt text is not describing the photo, it's simply listing the physician's name again. It's just adding unnecessary noise for screen reader users. And not something that's a problem in this particular example, but when you're writing alt text, you want to keep it at 125 characters or less. Screen reading tools typically stop reading alt text around that point. So what is a good example of alt text? Now, that kind of depends on who you ask, because it seems like everyone has a personal preference. So on this slide, I have 3 different versions of alt text. All are technically WCAG compliant, but in my opinion, one offers a better user experience. The first example is from the previous slide, and it reads, "Image of Dr. Cecile." It's okay, but it's not really helpful. The second example is marking the image as decorative, because this image really is not adding a lot of value to the content that's already there. Again, not helpful, but also doesn't add unnecessary noise. And then the third example reads, "Headshot of Mary Cecile wearing a blue sweater." This is a good example because it gives an indication of the angle the photo is taken from and a brief description. The second issue I see a lot is low text to background contrast. Low contrast makes reading the text harder. It's especially difficult for people with low vision and aging adults, but it also causes eye strain and higher cognitive load for just about everyone. So WCAG requires a text to background contrast of 4.5 to 1 for normal text and 3 to 1 for larger text. In healthcare, we typically see a lot of blues, greens, and sometimes yellows. So on this slide, I'm showing examples of common color combinations. We typically see like a teal text on a light teal background, or white text on lime green, and yellow text on blue. These examples all fail for normal size text. Only the yellow on the blue passes for larger text. Now, if we tweak these colors a bit, we can get them to pass for all text sizes and make them easier and faster to read. So on the slide is now showing a darker teal text on a lighter teal background, dark gray text instead of white on the lime green, and the same yellow just on a little bit darker blue. But what about when you have a background image or a video with text over top of it? How can you ensure the text to background ratio passes when the background is changing? And that's number 3 in my list of common mistakes, because many designers think that adding a drop shadow to the text will add enough contrast to be compliant. And in reality, it just really depends. So on this slide, I'm showing a typical hero or banner image. And in the background is a building with a tan sky and white text over the image. There's a drop shadow on the text to hopefully add some contrast for lighter background areas. But with this tan colored sky, it's close, but it does not quite pass. So yes, sometimes adding a drop shadow to the text is enough. But most of the time, you'll need to use different techniques for different backgrounds. The important part is really making sure that there is a distinct boundary around the text to ensure readability. Now, issue number 4 that I see a lot are creating headlines or headings by only changing the font size. Many web pages are lacking headings, or they don't use headings properly. And content authors need to ensure that they're using heading tags, so H1 through H6, when they're actually adding content to a page or even a document. Similar to sighted users, screen reader users quickly browse web pages using headings and bullets. But while a sighted user can pick out which content is most important by font size and position, Screen readers rely on the code or the markup. So when a content author changes the font size and the weight, instead of adding the proper HTML headings, important information gets lost. So let's take a look at this example. On this slide, I have a screenshot of a web page that I put together, and it reads, headings are important, followed by two different lists. I have women's diseases and men's diseases. And for a sighted user, this page makes complete sense. Menopause falling under women and prostate cancer falling under men. But let's see what this would be like for someone using a screen reader. Now I'm showing a tree view of the heading tags on that same page. Rather than appearing as two lists, it's showing one list of women's diseases with all the conditions nested under that heading. The page no longer makes sense because last time I checked, women don't have a prostate. But why is this happening? It's because I didn't mark the men's disease heading as an H2. Instead, I simply changed the font size and color. Number 5 on issues that I see quite commonly are that controls only work with a mouse. Now, there's a lot of developers out there who, when they're coding, don't even think about using a keyboard to test things. However, when you're looking for accessibility, your digital assets must be entirely functional using only a keyboard, not a mouse. And that's because many users do not have the dexterity to use a mouse. And then there's other users who just prefer to use a keyboard. But so if you're building a website or an app to work with a keyboard, you're building it in a way that also supports speech input users, mouse users, and a wide variety of assistive technologies. One of the most common places I see this is with menu buttons on small screen sizes. So on this slide, I'm showing a standard web page header for a phone size screen. We have a logo, phone icon, search icon, menu icon. And then there's a standard text link a little bit lower on the page. If you're a mouse user or a touchscreen user, there is no issue on this page whatsoever. However, when we try navigating this page using a keyboard, we start at the logo, move to the phone, then to the search, but we skip over the menu and go to the text link and the copy. So there's absolutely no way to open or close this menu using a keyboard. What that means is that your website is unusable and you're actually preventing people from accessing the content on your site. Probably not what the marketing team was going for. And this happens because whoever coded this header didn't use the proper HTML. Luckily, it's a really easy fix for a developer, but it's just something I wanted everyone to be aware of. And the last issue that I commonly see, well, I see lots of other issues, but the last one I want to talk about today is inaccessible PDF documents. So as part of WCAG, all of the content on your website or your app needs to be accessible. And this includes PDFs, Word docs, presentations, and spreadsheets. But in order to make those documents accessible, you must be creating them and tagging them in a way that supports accessibility. So each document is essentially its own web page, and it needs to comply with WCAG rules level AA. Now, most application software comes with accessibility checkers built in to help you make your documents accessible. So now that you have a better understanding of what accessibility is, let's go back to Section 504 exceptions. Section 504 gives 5 exceptions for content that does not need to comply. The first of these exceptions is archived web content. Now, in order for your content to be considered archived, it must meet all of the following. The content was created before your compliance date. The content is kept only for reference, research, or record keeping. The content is kept in a special area for archived content, and it has not been changed since it was archived. An example of this type of content would be like an old annual report. So this report, if the annual report is posted in a clearly labeled archive section and only used for reference or record keeping, it would not need to be retrofitted or made accessible. However, if this content is ever updated after your compliance date, then you are required to make it accessible. Now, does that mean you can just move all of the content on your site into an archive section? Absolutely not. Most of the content on a healthcare site is used to help patients find care and services, so it would not qualify under this exception. However, I encourage you to use this opportunity to really assess your content. Go through it and see what kind of content is on your site. Get rid of old, outdated stuff. Update the content that's still useful, and archive anything historic. The second exception is pre-existing conventional electronic documents. That is a mouthful. What the heck does that mean, right? This would be things like PDFs, Word docs, presentations that are not used to gain access to or participate in services, programs, or activities. And it was added to your site before your compliance date. So for example, a PDF advertising a gift shop sale that already took place. This content would not need to be retrofitted. However, if you have a PDF advertising an upcoming sale, you would need to make that content compliant, because even if it was posted before your compliance date, the event has not yet happened, and you want everyone to be able to participate. The third one is pretty cut and dry. It's content posted by a third party. So content posted by a third party does not need to comply unless the third party is posting due to an agreement with your organization. So for example, if a member of the public comments on a social media post and they include a link to an event that your organization has nothing to do with, this content and the event's website do not need to comply. However, things like ER wait times that are posted on your site by a third party like MyChart, they must comply because you have an arrangement with that company. Exception number 4, individualized documents that are password protected. So this would include Word docs, presentations, PDFs, or spreadsheets that are specific to a person or an account and are in a secured section like a patient portal. This one's a bit more complicated, but hopefully this example that I'm going to give helps. So patient portals typically allow you to export files. These files do not need to be compliant if they meet the criteria. So like a PDF of a patient's medical bill that is accessed from their secure portal does not need to comply. However, that same medical bill inside the same portal in HTML format, so typically within the user interface, that would need to comply. So the difference here is essentially the file type. One is a PDF that's exported, the other one is actually inside the software itself. And last, there is pre-existing social media posts. This one is also pretty straightforward, but there's no need to go back through all your social media posts to add alt text or make them all accessible. However, posts made on or after your compliance date do need to be made accessible. So what's it mean to make a post accessible for social media? It means including alt text for images. Every social media platform has a way to add alt text. Some are a little easier than others. It also means that if your image contains text, the text needs to meet the contrast requirements. If you have a video, the video must provide captions and audio descriptions. And if you don't know what audio descriptions are, I suggest doing a quick little Google search because they are really quite important. Your links need to be concise, yet descriptive. And things like charts and graphs and infographics, they will likely need full text descriptions to provide the same content in a non-visual format. So this is not a complete list. These were just some things that I thought of off the top of my head that would apply to social media posts. So please refer to WCAG for more details. Now, one more thing to note is that while your posts need to be accessible, you are not responsible for ensuring that the platforms themselves are accessible. All right, that was a lot of content in a short amount of time, and you're probably feeling a little overwhelmed, probably a bit stressed. So how do you get started? First, you need to realize that compliance is a shared responsibility. It's going to require cross-team collaboration. Execs throughout the organization are going to need to prioritize accessibility. Managers are going to have to offer training and provide extra time to make these assets accessible. IT needs to make sure they're purchasing products that are already accessible. Legal teams need to evaluate the policies and disclaimers, and your marketing team needs to make sure all your digital assets are accessible. Perhaps the first thing you need to do is really just sit down and come up with a list of all your digital assets, websites, apps, kiosks, bill pay, third-party applications, and don't forget all those PDFs and online documents. Then you need to do a high-level audit of those assets. And this is where an accessibility scanning tool comes in handy. But you need to understand those scanning tools are not going to catch everything. Manual testing is still going to be required. Next, evaluate your team's knowledge and provide training, especially if this is new to your organization. I suggest putting together a committee because this is a really large undertaking and it's going to require a lot of collaboration. I suggest including designers, writers, developers, managers, and various stakeholders so that you have a wide variety of expertise from various areas. Then make a plan and prioritize the work. And lastly, just take pride in your efforts because the work that you're doing really does impact people's day-to-day lives. With that, let's open it up for questions.
Thank you very much, Amanda, for this insightful presentation. I know the audience got a lot out of it, and it's going to help a lot of people down the road and along the way with their journey towards web accessibility. Now, let's say there's somebody out there who has a long to-do list, but a small team, and they can't tackle everything at once. Where would you recommend they start when it comes to web accessibility?
That is a really good question. I would start by looking at your traffic and focus your efforts on areas that have the most traffic. So if that's your website, most of your issues are probably going to be found in your header or your navigation and with forms. So I would focus your efforts there. Those are probably the areas I see the most issues or the most blockers when I'm testing a website.
Very good. Thank you, Amanda. Everybody, thank you again for joining, for listening, for being a part of this very important webinar. If you have further questions or need help with a web accessibility audit, we are here to help at StayMates. You can contact us at info@staymates.com or visit us on our website at staymates.com/contact to fill out a form. We have some more related links. We have a brand new white paper meeting HHS Section 504 accessibility standards, as well as a couple of blog posts on our website and a PDF accessibility tips article as well. Everybody, again, there will be a recording sent to you in the upcoming days, and feel free to reach out anytime you have any questions in regards to web accessibility. Thank you so much.